Every 40 seconds in the United States, someone experiences a stroke. That means by the time you finish this short video, another family could be facing a life-changing moment. After the age of 60, many of us worry about blood pressure, cholesterol, or family history. But here's something often overlooked. The way we take everyday medications can quietly raise or lower that risk. The encouraging part is this. Your medicine cabinet is one of the few things you can actually control. You don't need to change your entire lifestyle overnight. Sometimes it's as simple as checking a pill, lowering a dose, or switching to a safer option. These small steps can add up to a powerful shield for your brain and your independence. So before we go through the 7 common drug groups linked with higher stroke risk, let's do a quick exercise together. Take 10 seconds, grab your pill organizer or a small bag with your daily medications. Keep a pen and paper or even your phone right next to you. As I mention each group, simply mark whether you or someone in your family is taking it. This way, you'll know instantly which areas deserve a conversation with your doctor. It's a small action, but it could be the most important step you take today. Because protecting your health doesn't always start in the hospital. It starts right at your kitchen table. Number 1. NSAID, ibuprofen, naproxen. Non-steroidal anti-inflammatory drugs, or NSAIDs, are some of the most common pain relievers used by older adults. They help with arthritis, sore joints, and everyday aches, which is why bottles of ibuprofen or naproxen are in so many medicine cabinets. But large studies published in the BMJ found that certain NSAIDs, especially ibuprofen and diclofenac, are linked to a higher risk of stroke compared with not using them. The results varied between studies, but the signal was strong enough that experts urge caution in seniors. The reason is simple. NSAIDs can make the body hold on to extra salt and water, which raises blood pressure. They also affect how blood clots form, creating the perfect storm for fragile arteries. So, what can you do right now? First, if you need pain relief, try topical options like diclofenac gel or capsaicin cream. They target the joint directly without stressing the heart and brain. If oral medication is absolutely necessary, use the lowest dose for the shortest time possible. Whenever you take NSAIDs for more than a few days in a row, check your blood pressure at home for 1 to 2 weeks. And if you find yourself using these pills more than 10 days each month, it's time to schedule a medication review with your doctor or pharmacist. Remember, relief from pain is important, but it should never come at the cost of your long-term independence. Number 2. SSRI, sertraline, fluoxetine, citalopram. Selective serotonin reuptake inhibitors, or SSRIs, are widely prescribed for depression and anxiety. For many people over 60, they can be life-changing, helping with grief, mood swings, or sleepless nights. But here's the hidden risk. When SSRIs are combined with blood thinners like warfarin or the newer DOACs, the danger of major bleeding goes up sharply. A 2024 study in JAMA Network Open found that this risk is especially high during the first few months of combined treatment. That bleeding can show up in the stomach, the intestines, or even the brain, increasing the chance of a hemorrhagic stroke. So what can you do right now? Start by asking your doctor or pharmacist directly, are my antidepressants safe with the blood thinner I'm on? Watch for warning signs at home, unusual bruises, frequent nosebleeds, or black tar-like stools. If any of these appear, don't ignore them. Bring them up immediately at your next medical visit or sooner if they worsen. Also remember that medication isn't the only option for mood support. Cognitive behavioral therapy, gentle daily exercise, and social connection can all reduce depression symptoms and may allow for a lower SSRI dose over time. The goal isn't to stop treatment, it's to balance mental health with brain safety. so you can feel better without putting your independence at greater risk. Number 3. Benzodiazepines, alprazolam, diazepam, lorazepam. Benzodiazepines are often given to help with sleep or anxiety. For many older adults, pills like Xanax, Valium, or Ativan can feel like a quick solution after restless nights. But for people over 65, these medications carry serious downsides. They slow the brain and body, leading to drowsiness, dizziness, and poor balance. That's why seniors on benzodiazepines face a much higher risk of falls and head injuries. Research published in AHA journals shows that older patients who take benzodiazepines around the time of a stroke often experience more severe outcomes and even higher mortality. This means the very pill meant to calm you could make recovery harder if a stroke does occur. So what should you do? First, never stop these medications suddenly. Quitting cold turkey can cause dangerous withdrawal. Instead, ask your doctor for a clear tapering plan over 4 to 12 weeks if you've been on them long term. Second, explore safer alternatives for sleep, like good sleep hygiene, reducing caffeine late in the day, or using a small dose of melatonin under supervision. And if anxiety is the main issue, consider counseling, relaxation routines, or breathing exercises that don't raise your fall risk. The message here is simple. Better sleep and calmer nerves are important, but they should never come at the cost of your safety or independence. Number 4. Old-style antihistamines, diphenhydramine, Benadryl. Many people think of Benadryl as harmless because it's available over the counter. It's often used for allergies, and some older adults even take it at night as a sleep aid. But here's the hidden problem. Diphenhydramine belongs to the first generation of antihistamines, and it has strong anticholinergic effects. That means it dries the body out, clouds thinking, and can make balance less steady. For seniors, that combination leads to confusion, dehydration, and dangerous falls. And the concern doesn't stop there. Long-term use has been linked to a higher risk of dementia in adults over 65, according to large cohort studies published in JAMA Internal Medicine. So what's the safer path forward? For daytime allergies, choose newer, non-drowsy options like loratadine or cetirizine. If you're taking Benadryl just to sleep, it's time to break that habit. There are better ways to rest. Focus on sleep hygiene. Dim the lights an hour before bed, avoid screens, and keep a consistent bedtime. Even small changes like these can improve sleep quality without adding risks to your brain and independence. Remember, over-the-counter doesn't always mean safe, especially after 65. Number 5. Sulfonylureas, glyburide, glipizide, glimepiride. Sulfonylureas are older diabetes drugs that work by pushing the pancreas to release more insulin. For seniors, this extra push can sometimes be too much. Studies in JAMA Network Open and Diabetes Care show that older adults on sulfonylureas, especially those with lower HbA1c levels, face a much higher risk of severe hypoglycemia requiring hospitalization. And here's the worrying part. After a dangerous low blood sugar episode, many patients are not taken off the same strong treatment, leaving them vulnerable to another crisis. Severe hypoglycemia at night can trigger adrenaline surges, irregular heart rhythms, and even increase the chance of stroke or heart events. So what can you do right now? First, ask your doctor if a newer class of diabetes medication, like DPP-4 inhibitors, GLP-1 receptor agonists, or SGLT2 inhibitors, might be safer for your age and condition. If you're still on a sulfonylurea, make it a habit to check your blood sugar before bed and again first thing in the morning. Add a small protein-rich evening snack, like a handful of nuts, Greek yogurt, or a slice of cheese with whole grain crackers to help keep your glucose stable overnight. The key is not to panic, but to stay alert. Managing diabetes should support your health and independence, not put you at greater risk of a nighttime emergency. Number 6. Levothyroxine, when dose is too high. Levothyroxine is one of the most prescribed medications for seniors with an underactive thyroid. When the dose is just right, it helps restore energy, mood, and metabolism. But in older adults, overtreatment is common, and it carries hidden dangers. If thyroid hormone levels go too high, blood tests show a low TSH, and that can trigger atrial fibrillation, an irregular heartbeat that raises the risk of stroke up to fivefold, according to NIH reviews and recent medical summaries. Excess thyroid hormone can also speed up bone loss, leaving seniors more prone to fractures that further threaten independence. So what steps should you take? Make sure your TSH is checked every 6 to 12 months, not just once every few years. If you notice palpitations, racing heartbeat, trouble sleeping, or unexplained weight loss, tell your doctor right away. These can be early signs that your dose is too strong. And don't hesitate to discuss lowering your dose if your TSH is below the target range for your age. The goal is steady energy without tipping into overdrive. With the right balance, thyroid medication supports your health without quietly raising your stroke risk. Number 7. Hormone replacement therapy, estrogen, plus progestin. Hormone therapy after menopause can bring real relief from hot flashes, night sweats, and bone aches. For many women, it feels like getting life back on track. But the landmark Women's Health Initiative trial, published in JAMA, found that women on combined estrogen and progestin had about a 31% higher risk of stroke compared to those on placebo. That translates to roughly 8 additional strokes for every 10,000 women each year. The risk appears greatest with higher doses and longer use, especially in older postmenopausal women. So, how can you stay safe while still managing symptoms? If hormone therapy is necessary, doctors recommend the lowest effective dose for the shortest possible time, with regular checkups to reassess need. Some studies suggest that transdermal patches or gels may carry a lower risk of blood clots and stroke compared to oral tablets, though the choice depends on each person's medical history. And it's important to distinguish between low-dose vaginal estrogen, used for dryness or urinary symptoms, and full systemic therapy. Vaginal estrogen has minimal absorption into the bloodstream, and large observational studies show no significant increase in heart or cancer risks, which is why groups like NAMS and ACOG consider it safe for many women. The takeaway is this: hormone therapy can improve quality of life, but it must be used with caution and careful monitoring. Relief is valuable, but protecting your brain and independence is priceless. Connection. When you look at all 7 groups together, a clear pattern appears. These aren't dramatic overnight changes. They're small adjustments, switching to a topical cream, lowering a dose, choosing a safer formulation, or checking your numbers more often. Each step adds another layer of protection, like stacking shields around your brain and your independence. And the best part is, every one of these actions is within your control starting today. Because it's not just about avoiding stroke, it's about preserving your freedom to move, think clearly, and live life on your own terms. If there's one thing you can do right now, it's this: schedule a simple 15-minute meds check with your doctor or pharmacist. Bring a clear list of everything you take: prescriptions, over-the-counter pills, and supplements. Write down the exact dose, the time you take it, and the purpose, whether it's for pain, sleep, blood sugar, or thyroid balance. Then, prepare one page of quick questions. Is there a safer option for my age? Could I lower the dose or switch to a different form? What should I monitor closely in the next 30 to 90 days? This short conversation can uncover safer alternatives, reduce hidden risks, and give you peace of mind. Because protecting your brain and your independence doesn't start with a new prescription. It starts with asking the right questions about the ones you already take. So don't wait. Book that check-in, subscribe to this channel for more practical health insights, and remember, every small step today helps secure your freedom tomorrow. Disclaimer: this content is for information only and is not a substitute for medical advice. Always talk with your healthcare provider before making changes to your treatment.